really like to thank the audience who are here. If you could please pan the audience. And I'd also like to thank the viewers who are watching this video. When you hear the word schizophrenic, what mental picture do you have? Do you see someone talking to themselves, having multiple personalities, and having to live their life in an asylum? Now try to picture a child no older than 10 having schizophrenia. What do you see? Does that child no longer have a bright future? Will they ever be able to live a normal life? Early onset schizophrenia is a very rare condition in which children under the age of 13 are diagnosed with this misunderstood mental illness. Schizophrenia has almost the same symptoms as autism spectrum disorder, and children under the age of 13 are sometimes misdiagnosed with schizophrenia when they may actually be on the autism spectrum. Today, I will discuss the symptoms of both early onset schizophrenia and autism spectrum disorder, how they compare to each other, and how being misdiagnosed with early onset schizophrenia is detrimental to a child's future. When parents notice that their child is not functioning within the normal developmental range, they take their child for an evaluation to determine the cause and to seek interventions for the child. In this case, children who are not only exhibiting developmental delays but also inappropriate behaviors are often seen by psychiatrists or psychologists. The evaluator will then assess the child based on presenting symptoms. In this discussion, we are comparing the diagnosis of schizophrenia to autism, so I'd like to define these disorders as a reference. The DSM-5 defines schizophrenia as someone who suffers from delusions and are unable to decipher fantasy from reality. The DSM-5 defines autism as someone who suffers communication difficulties or forming relationships with others. The evaluation of a child is completed using several measures, including formalized, standardized testing, behavioral observation, as well as developmental history and learning assessments. Other tests that may be utilized are blood tests to rule out drugs or alcohol as the cause of the symptoms. The result of these evaluations provide the information for the diagnosis. However, sometimes additional assessments are required to find the true cause of the child's behavior. The symptoms that are characterized in early onset schizophrenia are language delays, late crawling or walking, abnormal motor behavior such as rattling or rocking, hallucinations, delusions, disorganized speech and behavior, or catatonic behavior, which is characterized as a coma-like state or hyperactivity. To diagnose the children with early onset schizophrenia, the child must have 2 or more of those symptoms. Now I'll discuss the symptoms of autism spectrum disorder. They are communication difficulties, abnormal behavior at inappropriate times, and repetitive behavior. As you will note, the symptoms are almost identical, and this is where the importance of additional testing is demonstrated. Children or adults with schizophrenia have different brain structure than those with the disease. To make correct diagnosis, it is imperative that the routine evaluation tools be supplemented with brain scans such as MRIs and CT scans. It is important to note that schizophrenia in children under the age of 18 is very rare, with the most current statistics being that 1 in 68 children have autism spectrum disorder, whereas 1 in 40,000 children actually have early onset schizophrenia. A study was completed in 2011 by the Child Psychiatric Branch of National Institute of Mental Health to determine if there were a high percentage of children being misdiagnosed as having early onset schizophrenia, or when their true diagnosis should have been autism spectrum disorder. Now, in the evidence of this study, they started with 121 patients who had been diagnosed with early onset schizophrenia. Just within outpatient testing of behavioral studies, they were actually able to rule out 28 children to have autism. Now, with inpatient screening, with viewing their behavioral traits and also doing the MRI and CT scans, they were able to rule out another 63% of those children as having not only autism, but some other mood disorders such as bipolar. The studies, however, were unable to really get a true diagnosis or a true outcome because most of the children that they were testing were on the medications that are used for both early onset schizophrenia and autism disorder. Now I'd like to discuss with what the MRIs and the CT scans show in comparison to people who have autism to those who have schizophrenia. In the MRI and CT scans, it's actually coming up that children or adults with schizophrenia have a larger gray matter area of the brain. Now, as you can see here is a picture of a brain, and this dark gray area that you see is actually the gray matter. So in schizophrenic patients, this gray matter is a lot more prominent than what you would see in the gray area. So why then is misdiagnosing children with early onset schizophrenia so detrimental? An article was published in Psychology Today where they actually listed some myths and misconceptions about schizophrenia. They were the common misconceptions that people have about schizophrenic people are that they are dangerous, unpredictable, they have character flaws, they need to be hospitalized, they are untreatable and therefore can't live productive lives, and they will never have normal functionings, and the medications prescribed to people who have schizophrenia are actually worse and make them into sort of zombie-like. There was also a study done in 2011 by the Journal of Psychiatric Practice in which they compared media outlets' stigma of schizophrenia in 2000 and 2010. They found that the media's metaphorical use of schizophrenia in both 2000 and 2010 was negative, furthering the misconceptions of schizophrenia. So what is the best practice when it comes to assessing children who are exhibiting behaviors that are similar to both early onset schizophrenia and autism spectrum disorder? Early intervention is essential in successful outcomes for students with autism disorder, so it is important that we continue to assess as early as symptoms appear so that the appropriate interventions can be implemented. However, it is best to withhold the diagnosis of early onset schizophrenia until the child has developed at least into adolescence, and then performing both the psychological as well as the medical testing such as the MRIs and CT scans. By allowing the child to develop in early childhood, the risk of incorrect diagnosis continues to decrease. The benefits of the child are the child will not have to live with that schizophrenic label, as I mentioned before, of the misconceptions that people have. And because the medications that are used for early onset schizophrenic children are the same as the medications they use for autism, putting them on without giving them the label of schizophrenia may not only help keep the label away, but also if they're successful with those medications, it may also indicate that they have autism and not schizophrenia. And also, doctors should be required to have brain scans before diagnosing instead of only it being a choice to do it or not. Being diagnosed with early onset schizophrenia is very serious and may ultimately damage the child's ability to live a so-called normal life. When labeling a child under the age of 18, the child's identity is changed at the time in their life when both self-esteem and self-determination are developing, and this may cause both internal and external scorn and the belief that they are psychotic and have no future. In conclusion, it is the ethical responsibility of all who work with children to be diligent in their diagnosis and refrain from making a diagnosis that is incorrect, such as in the cases of early onset schizophrenia and autism spectrum disorder. These two disorders share many common symptoms, as we have learned, and it is in the best interest of the family and the child that a diagnosis of early onset schizophrenia be withheld until the child is over 13 years of age. At this time, I'm open to any questions that the audience may have. Yes?
How does a doctor determine you're bipolar?
So with bipolar disorder, doctors, like in both autism spectrum disorder and schizophrenia, they'll observe the behavioral traits, and also they won't necessarily do a brain scan because there haven't been many studies where they look at brain scans of people who have bipolar. But bipolar is kind of defined as having like manic episodes in which the person may be really happy at one point in time for like a couple of months or a couple of days or weeks, and then completely drop down into like a depressive state. So That's kind of, they really focus on the behavioral instances for bipolar disorder. Does anyone else have any questions?
Do you really feel that the children who are diagnosed with autism have a chance at a more normal life? Or are they just as prone not to have a normal life as someone with schizophrenia?
I think that the stigmas of schizophrenia are a lot worse than the stigmas of autism. I mean, in today's world, there are many autistic people who live out successful lives. If you look at someone like Bill Gates, who's known as a high-functioning autistic,
okay.
you know, he's very successful, so people won't have that stigma that they have of schizophrenics.
Thank you.
Anyone else? Is that it?
Do you have a question?
All right, well, thank you for watching.